computer. There you go. All right, I'm gonna stay on for a few minutes to make sure you guys get all settled. If you need anything from me within 10 minutes of starting, go ahead and enter the chat. Otherwise, I'm gonna leave you guys to it. I'm so excited for you guys. Go for it.
Oh my gosh, where are we? Thank you. Thank you again.
Okay, bye, good luck.
Ready?
Yes. Oh my goodness. And then, yeah, it still looks normal. So exciting. Hello. Hi, you all.
Hello.
Hello, hello. Welcome. Happy Tuesday.
You don't want to be on
You want to be on camera? Yeah. All right.
People ask to use the computer. Ooh, don't stop.
It's 5 o'clock.
It's 5 o'clock. When they're done.
There you go.
My alarm went up. Let me
All
see.
right. Are you guys ready over there? Are we waiting for anybody else?
Oh, she talking about it. Can you hear us?
Yes. Yeah.
Okay. Yep, you can go ahead and get started. I think we're good. Yeah. Do I need to, you want me to place the camera? Not in, okay. If you have any questions, you can just go up here. It's just so you guys can see,
Okay.
try to see everything.
Yay. Hi, everybody. Oh, this is so exciting. Thanks for being here.
Okay.
I hope you guys are as excited as we are. Hello, hello. Welcome to the Period Education Projects program called our PEPrally, because we all love a PEPrally. I do. Okay, so the PEP in PEPrally stands for the Period Education Project. So our main goal today is to talk about our bodies, talk about our periods, our menstrual cycle, really get the jitters out, talk about it like it's normal, because you know it is normal, and you know really just understand our bodies better. So we'll do a quick introduction and then we'll get going. Okay, so my name is Katie Ellis, and I am a second-year medical student in Louisville, Kentucky.
And my name is Onyee, and I am also a second-year medical student at Louisville, Kentucky.
Yes, so that means that we have 2 more years of school until we become doctors, which is crazy.
Yeah.
But we're just here again to talk to you guys about your health and your bodies. And we're doing it through a program called Girlology, whose mission is to, oh, can you guys hear us? Sorry.
You have to press the button. Is it on music? Is it picture off? Where is it at?
Do you want us to like speak to see if you can hear us now?
I wonder if the presentation, like if they're presenting it on it.
Oh, okay. Well, let's put in the chat.
We're trying to get the volume to connect to the TV. We can hear you from the laptop. So if you don't mind, 1 second, please.
Yeah,
Okay.
absolutely. Yeah,
Perfect.
take your time.
Right here, take the picture off.
Left you, I was missing.
Okay, so the volume is connected. It's just, okay, let's try to secure it again.
Okay, can you hear it? Is that better?
Okay, do you mind saying
Yeah.
something?
Yes, can you hear this?
It's just beats.
Oops. Yeah, we can do that. Okay, I agree.
It said it was connected to the Samsung. Right?
Yeah, it's just, so I guess we can't connect both, like, cause they'll show them up here, but then when I go to connect the sound, it doesn't, like it clicks out of it. As if we can't do both.
Do you know what those little tablet cords are? I guess it's, yeah, just let them go on. Yeah.
We can also just really project our voices, speak really loud if it's not connecting.
Okay.
Or we can also wait another couple minutes if you can troubleshoot, whatever works best.
Okay, yeah, we can just go ahead and continue, that way we won't get you guys behind. So I guess just projecting is gonna be the best option right now.
Okay, we can do that. Did you guys hear us introduce ourselves, or do you want us to do that one more time?
Did y'all hear their introduction? Or y'all want me to repeat it? No, man.
Okay,
They did.
yeah, we can do that again. So my name is Katie Ellis, and I am a second-year medical student in Louisville, Kentucky.
And my name is Onyee, and I am also a second-year medical student at Louisville, Kentucky.
Yes, so that means that we have just 2 more years until we are doctors, which is crazy.
Yeah.
And so we're just here with a program called Girlology, that their mission is just to teach girls about their health. So we've been trained as period pros, as you can see on the screen. And we're just going to teach you guys about your bodies, about your health, about your menstrual cycle, and things like that. So we can go ahead and get started. Here is what we'll cover today. You can just, yes. So we want to make sure that you guys understand things about your body, about periods, about period products, and where you can get help or healthcare if you need it. And even though some of these things can feel really awkward to talk about, we've been there, we get it. The more we talk about it, the easier it gets, and the more normal it feels, and the less awkward it feels. So that's how we will help to end the stigma. So before we get started, we want you guys to participate with us. We'll do this all together and say these words with us. So everybody say period.
Period.
Period. Okay. And next one. Oh.
Everyone say tampons.
Tampon. Okay. Next one. we're gonna all together say vagina.
Yeah.
Yep, vagina. I know it feels awkward, but again, the more that we talk about it, the more normal it feels because it is normal. It's just our bodies. Next one is vulva.
You want to do it on a count? Maybe like.
Oh yeah, we could do it on a
count.
count. Yeah.
So on a count of 3. So 1, 2, 3.
Vulva. Good. We're getting there. Okay, a few more. Actually, just one more. Okay. On the count of 3, everybody say discharge. So 1, 2, 3. Discharge. Okay, great. I think you're ready. So these are a lot of the words that we'll cover in the next little bit together. And we're going to get really comfortable with a lot of these words. So here we go. Before you can know your flow, know about your period and the menstrual cycle, first you have to know about your body. So let's make sure that we're just going to review the body parts that we're going to be talking about today. So let's start with the inside. We have lots of body parts, and I'm sure that you all can name these here. The brain, the heart, the lungs, easy, right? Yeah. But what about the inside parts that are involved with our periods, our reproductive system? I know there's a lot of parts, and some of you may know some of them, some of you may not. So to start off, I'm going to give you all 60 seconds to try and name all of these parts. And I think we have a word bank. Yeah. Okay. So you guys talk amongst yourselves for 60 seconds, try and figure out what you think all of these labels are.
Oh.
I can help facilitate. What do you guys think number 1? What do you think number 1 could be? Yeah, I heard it. Yes. Yeah, the fallopian tubes. What about number 2?
Wait, what did you say? Sorry.
Oh, I can do both. I'm gonna just snap some pictures too.
Okay, I'm gonna give you like 5 more seconds.
Okay, ready. We should work here. We don't snap some pictures, okay?
All right, so I'll go ahead and put the correct terms on the screen. Here are the answers. So I did hear that number 1 was the fallopian tube. Great job. Number 2 here is the uterus. So I'm going to start talking about that one. Hold on. Okay. So number 2 is the uterus, and that is where like babies grow. Some people call it the womb. It's really cool. It's my favorite body part. It's hollow in the middle, which is the place where a fertilized egg can attach and grow into a baby. It's made of muscle, so it's really strong, which makes sense because you have to push a whole baby out. So it has to be really strong. It's also super stretchy because, again, if you think about it, you're growing a baby. So it's really stretchy, really strong, and that's the uterus. Okay, the next one I'll talk about is number 3, which is called the endometrium. So the endometrium means the inner lining of the uterus. So this is where your periods come from. The endometrium has things like blood, tissues, nutrients, fluids, all things that become a part of your period flow when that happens. Okay, number 5 is pointing to the cervix. So that's at the bottom of the uterus, and it acts like a little gateway for your period to get out. So it's in between the uterus and the vagina, and it has a little hole that allows your period flow to leave your body. Its main purpose, though, is to keep a baby inside. So when you're pregnant, it acts as a little stopper, and then it opens when you give birth. The cervix is also how a tampon cannot get lost in your body because it basically creates like a dead end at the top of your vagina, which is the next thing I'll talk about. So number 6 is the vagina, and the vagina connects the uterus to the outside world. It's not just an opening, it's actually a soft tunnel so that a baby can get out, and if there's no pregnancy, where the period gets out. So we'll talk about number 1 now, which are the fallopian tubes, which again, you guys got, great job. That is hangs over, it connects the uterus to number 4, which is the ovary. And that is where the eggs are stored. That's where the eggs grow, and the egg is released from the ovary and travels into the fallopian tube, then to the uterus, and then you have a period again through your cervix and vagina. So, whoo, that was a lot. Oh, sorry. Okay, but now it's your turn. I know we just quick reviewed that, but let's do one more quick review with all of the parts labeled. So you guys go ahead and tell me where the eggs grow. So we'll start where it says start here. The ovary, great. So after ovulation, they go into the it's the tube that connects the ovary and the uterus. Do you guys remember? It's the fallopian tubes. Okay. So then the egg travels through the fallopian tube towards the what? The big muscle where you grow a baby, where your periods come from, the uterus. Cool. There, the egg lands in the inner lining. Do you remember what that's called?
What?
Close, before the cervix. It's the endometrium. Then the endometrium, if there's no pregnancy, isn't needed for growing a baby, so it's released as the period. The first place that the period passes through is the, I just heard it, the cervix, yes, the cervix. And then it leaves out of the you guys know?
The vagina.
Yes, the vagina, perfect. Wonderful. Isn't it cool how all the parts work together? Yeah, great. Great job.
Okay, so Katie did an amazing job talking about the inside parts. So now we're going to talk a little bit about the outside parts. So we're going to show some super realistic images, but we're all mature here. And we're going to show like a drawing of the female private parts. Okay. Well, there she is. This is an up close drawing and a personal view of the outside parts of a female. So this is when a baby is born, the doctor is going to take a look at this part and would say that this is a girl. So this is the sex that is assigned at birth, or the biological sex. So as we did with the inside parts, we want to know what you already know. But before we get to that, we're going to talk about some nicknames that we have for our private parts. I know some people, I like to call my private part the kitty cat. So we can just shout out whatever names that you call the outside of like your female private parts. Do you have one?
Yeah, growing up, my mom would call it a hoo-ha. Hoo-ha. But no, those are ways that we can call like different. So I'm gonna just say some things that you might have heard
or some things that people say. So there's coochie, there's cookie, honey pot, there's pussy, there's a pocketbook, there's kitty cat, which is my favorite one, and then there's lady bits or TT. So even in like doctors' offices, we might hear a lot of like the slang or the silly names. But whatever you call it, it's very important that we know the real names and we're never ashamed to talk about those parts. Because the reason why it's so important is that when you know the real name, you can communicate with your doctor when you have an issue, okay? And also when you use the correct names, it helps to take away the taboo or the stigma that is attached to the female body. So are you guys ready to just spend some time learning about the outside female parts? Okay.
Yes.
So let's go. Okay, so kind of like with the inside parts, I'm gonna give you 60 seconds to see where these words go. So here's your word bank over here. And then you can just think of where each word goes, okay? And that's the word bank. So just 60 seconds. And these are a little bit tougher, but I believe that you guys can do it.
Yeah.
Oh, 8 is the old. Yeah, 8 is the anus.
Yeah.
I don't think urethra is, but I don't know where it's located. The what? MRNA? I don't even know what that is. But 8 is the anus for sure. I think 6 and 4 is the Labia and the you know, the correct the Labia Majora. I think that's it. Like it's a beautiful.
Number 7 is.
Number 7 is the vagina, right? Yeah.
I love the chatter I'm hearing. I'm gonna give maybe 10 more seconds and let you guys finalize your answers. But I love what I'm hearing.
I know 7.
I know 8, 6, and 4, and then 7.
I know 8.
So 4, 6, 7, 8.
And I forgot what 6 was, but I know 8.
5 is towards the top, and it's the urethra. We did a little top.
Perfect. So quickly, let's just run through the answers, right? So 1 is the vulva. So I'm going to just like run through the answers and then I'll like talk about the different parts in detail. So 1 is the vulva, 2 is the mons, 3 is the, okay, well, let's just go. There we go. 3 is the clitoris, 4 is the labia minora, 5 is the labia majora, 6 is the urethra, 7 the vagina, and 8 the anus. So let's now talk a little bit about this in details. I know you guys did a wonderful job, like I was hearing correct answers, but let's talk a little bit about what each one does, okay? So first of all, there's a common misconception that this area circled over here is the vagina. That is not correct. So the entire outside of your private part is actually called your vulva. And it's going to have several smaller parts that make up the vulva. So at the top of the vulva is your mons. It's like a fatty pad called the mons, and that's where hair is going to first grow during puberty. And then after the next is right here is the labia majora. So on each side, there are outer folds, which is called the labia majora. So in Latin, it just means like large lips. And people can also call them like the outer lips that make up part of the vulva. And that might be easier to remember, like the outer lips. And then between the labia majora and there are 2 other folds called the labia minora. These are called like your smaller lips, like the inner lips. And they're thinner They can be any size, and just kind of like in different body parts, like sometimes our eyebrows are not the same size. Like one of mine is like all the way up here. The other one is like a little bit more slanted. It's the same thing with your labia minora. Some of them are, one side might be thinner, one side might be longer. Some are tucked inside the larger lips. Some of them stick out outside the labia majora. Some of them are pink. Some of them are brown. Some are wrinkly. Some are smooth. But at the end of the day, all of them are normal. Okay? So there's no right or wrong way for anyone's labia minora to look like. Okay? And they're very important because the main purpose of it is to protect the sensitive areas inside, and they can also be very sensitive. But the labia minora is so cool. Then after that, we have at the top of the labia is the bump called the clitoris. The bump is the only part of the clitoris that you can see on the outside, but then the rest of the clitoris is actually under the skin, into the labia, and along the vagina. The clitoris is used to feel good when it's rubbed or touched, but it can also be super sensitive or hurt when it's bumped. So that's also, that's why it's also protected by the labia. Okay. So those are all parts of the vulva. Then we have 3 openings down there. Okay, we women are like, we have some extra parts. We have 3 openings. 2 of them are part of the vulva and 1 is not. So the opening at the top below the clitoris is the urethra. So this is how pee gets out of the body. And then below that is the vagina. Remember how we said that the vagina is like a tunnel, and this is how period fluid exits the body. And it's also how most babies get out. Okay. Now the last hole is not really part of the vulva, but it is down there, and it's the anus. So since it's one of the holes down there, we thought we would also talk about it. And this is where poop comes out from. I'm sure a lot of you know this. Okay. So that's kind of like the outside of the female anatomy. I know this was a lot, but I think you guys knew what you were talking about. So let's do another quick review and let's see if you remembered what I said. Okay, so let's start. All of the female parts together are called the... Yes. Okay, then there are the 4 parts. So let's start at the top. The fatty pad is called the... Yes. The sensitive bump is called the... Clitoris. Perfect.
This one goes first.
Okay. Yeah. The inner lips, no, the outer lips are called the... Right here.
Oh, it's not the same.
The inner lips are bigger, count.
So the inner lips are called the labia minora, and then the outer lips are called the labia majora. So the outer lips and then the inner lips, okay?
It's not on the same part.
Yeah. Yeah. Okay, and then the 3 openings. So you pee from the... Right here. And then your period and babies come out of the...
The vagina.
Yes, the vagina. Okay. And your poop comes from your...
Anus.
Yeah, awesome. Now that you know the proper names and you know a little bit more about each part.
That's weird.
Okay. So now that we've kind of talked about like the different parts, one thing we really want to talk to you about today is being able to tell what is normal and what is not normal when it comes to like your body and your menstruation. So to help you remember what's normal or not, Throughout today's presentation, we will stop and have you do some role playing every once in a while. We call this normal or nah. Okay, so we're gonna ask you to kind of just like pretend that a friend is asking you a question about their body or their periods. And because you guys are awesome people and you're here at this presentation, you're going to be able to help them know if it's normal or if it's not. And you're already becoming JV period pros, okay?
Yeah.
Okay, so here's how we're gonna do it. Like I said, I'll pretend to be your friend. I'll tell you something I'm worried about. I'll ask you if it's normal or not. If it's normal, you're gonna give me the thumbs up. If you think it's not normal, so a nah, you're gonna give like a little X. So let's practice. Is it normal? What are you guys gonna do? If it's normal, perfect. If it's not normal, what are you guys gonna do? Excellent. Okay, let's do the first scenario. So I'm coming to you. Okay, I'm coming to you. Oh my goodness, I was changing in front of my older sister the other day and she laughed at my pubic hair. She said I'm supposed to shave it. Is that normal?
Yeah. Is pubic hair normal?
You should shave that like that. That is hair. That's normal. See the third one might be normal. Which one?
Okay, I'm seeing a lot of thumbs up and yes, it is normal. So I want to make sure you know that pubic hair is totally normal, but some people think they need to remove it. But pubic hair actually has a purpose. So it helps protect the sensitive skin on the vulva from getting irritated by vaginal discharge, and it helps keep bacteria from getting into more sensitive areas. But sometimes it pokes out of the bathing suits or just seems like a little bit too much. So some people might want to groom it by either trimming it or removing some of it. So if you want to remove it or you want to trim it, just watch out for those labias because they could easily get snipped. And then if you want to shave some of it away, like in your bathing suit line, it helps to take some extra steps to make sure that you don't get any rashes, ingrown hairs, or any infected follicles. So if you do, we don't recommend shaving it all off, but if you do, here are some steps we want you to follow, okay? First, wash the area with some soap and warm water. This will help like soften the hair and also reduce bacteria. And always use a clean razor, a clean fresh razor, and shave in the same direction that the hair grows, okay? But remember, at the end of the day, whatever you choose to do with your pubic hair is your choice. So don't do it because someone else says that you should, because there is no right or wrong way to have pubic hair. You just have pubic hair, and it's nothing you should be embarrassed about because it's totally normal. Okay, so we have another scenario, okay? So I'm coming to you right now. And so I think that there's something wrong with my vagina because I have vaginal discharge that has been staining my underwear and maybe even bleaching it. So is this normal or not? Like having discharge, is this normal or not?
Everybody got one.
It's a mixture of hand, all of me. You like bologna, turkey ham together? That's cocaine.
Okay, I'm seeing a lot of I'm seeing some thumbs up, and I heard someone say it's normal. Yeah, and that's because discharge is totally normal. So let's talk about discharge for a little bit, okay? Because discharge, normal. Okay, so people don't talk very much about discharge, but it's another important part of how your body works. We want to make sure that you know it's normal, and we want you to kind of understand a little bit more about it. So vaginal discharge is that white to yellow creamy stuff that comes out of the vagina, and it typically dries up in your underwear. And sometimes it can stain or bleach the crotch of your underwear. And that's just because of the pH from your discharge reacting with the dye used to color the fabrics. It's all coming back to chemistry. So science is important sometimes. So sometimes like the crotch of your underwear can look like this in this picture, and that's totally normal. So why do we have discharge? Well, just like your mouth has saliva to keep it healthy, just like your mouth has saliva to keep it healthy, the vagina also has discharge, which helps it stay healthy. In fact, discharge is the way your vagina cleans itself. Isn't that kind of cool?
It's so cool.
It's like self-cleaning. So amazing. Like, I'm not even trying to be funny, but we literally love the female anatomy.
It's the coolest.
It's so unique in how it works. So discharge is normal, but sometimes a change in your discharge can signal a problem that needs medical attention. And sometimes people just worry about their discharge. So let's run through what's normal and what's not normal when it comes to discharge. So for a normal discharge, the color should be clear or whitish or yellowish. And sometimes if it's dry before or after a period, it can also be mixed with a little blood and it looks a little bit pinkish. So, but it's still normal. Okay, let's talk about the consistency. So it should be creamy most of the time, but it can become more clear or slimy during ovulation. And sometimes when it dries in your underwear, it can kind of look crusty or become darker in color. What about the odor? Vaginal discharge has a normal, mild odor, but it is not a bad smell. It's just a smell, okay? So everyone that has a vagina has discharge that is normal for them. But if you notice that something seems really different, it could signal an infection or a problem. So if you notice something different, just talk to like a doctor or an older person to help you, talk to your physician, okay? Okay, but speaking of odors, like I said, like, let's talk about one more thing. Everyone wants to talk about like, oh, the vulva and the vagina has a smell. And here's what we want you to know. A normal, healthy vulva is not, and I repeat, not supposed to smell like a flower or an ocean breeze. It has the natural smell, but it's not a bad odor. It's just a natural smell. Sometimes you might notice that the odor is a little bit stronger, and you might notice that after you've maybe exercised, you've been sweating, or if there's just a lot of discharge that has just been sitting on your skin for way too long. So the first step, if you think you have an odor, is to make sure that you are washing your vulva correctly. So let's talk a little bit about it. This might seem a little bit awkward, but this is so important that we know a little bit more about our bodies. So first, you want to make sure to soap up the areas where hair grows and the skin is folding around the groin and the butt area. And that's just because you sweat a lot in those areas, and there's also hair there, and hair will hold on to smell, okay? So you use just normal soap. You don't need any of the fancy feminine washes. In fact, a lot of those washes can be irritating on the skin, and you might have some sensitive skin. So we just recommend just mild soap. So then make sure to clean the inside of the labia with just water. So once you kind of like wash around the groin area, when you get to like your labia area, put the soap down and just clean the area with some water, okay? And that's because it can be very, very sensitive. You need to just spread the labia a little bit, wipe out the creases and any discharge or any fluids with some water. And I'm gonna say this, if there's anything you take from this, there are a couple of things to take from this. One that is very important, never put anything inside the vagina to clean it, okay? Because remember, like we said, the vagina is self-cleaning. What is the vagina?
Self-cleaning. Cleans itself.
Yeah, okay, ready?
Yes. Awesome. Okay, so now that we know all about our parts and what's normal and how to care for them and wash them, we're going to talk about periods, which is also called the menstrual cycle. So most of y'all probably know just like a little bit about it, but we're really gonna dive in there and go pretty deep. So starting with, what is menstruation? Menstruation begins when your brain sends hormones down to your uterus and to your ovaries and tells them to start cycling, tells them to start practicing to get ready for a baby. Typically, the first period starts between ages 9 and 16 years old, but the average age is around 12. So, like I said, the brain sends hormones to the ovary. The ovary is, I don't think you can see. Oh, here we go, right here. And the ovary, once it gets those signals from the brain, starts preparing an egg. Once it releases an egg, it does that. But at the same time, the endometrium, which is the lining of the uterus, while the egg is getting ready in the ovary, the endometrium is also getting ready for a baby. So it thickens up, it brings like blood and fluid and nutrients and creates this like big, nice place where a fertilized egg could go. And fills it, like I said, with blood, water, nutrients. And then once the egg is ready and the endometrium is ready, the brain sends another hormone down to the ovary and tells it to release the egg so that it can travel through the fallopian tubes towards that endometrium that was already getting ready for it to come. So that whole process of the ovary releasing an egg is called ovulation. Okay, so we ovulated, the egg travels through the fallopian tube. And then in this cycle, if the egg is not fertilized by sperm and there's no pregnancy, then the endometrium doesn't really have a job. You know, it was preparing to grow a baby, but that's not needed anymore. So instead, it's released from the body, here we go, this picture, as a period. So basically, the body gets rid of the old endometrium so that it can make a fresh new one for the next cycle and the next egg. And that's why your period is called the menstrual cycle, because it just keeps happening over and over and over again. So normally it takes about 3 to 7 days for the entire period to come out because it just trickles out slowly. It could feel like you lose a lot of blood, but a normal period has less than a couple of tablespoons of actual blood. And in total, it's about a half a cup over about 3 to 7 days. But it just feels like a lot more because, like I said, the endometrium has nutrients and fluid and tissue and other things that are also mixed in with the blood. It's also normal for the first couple of days of your period to feel heavy, like to flow heavier. And that's just because, it's trickling out and it slows down towards the end of your period, towards the end of that 3 to 7 days. Because of the differences in flow, it is normal and even recommended to use different period products or different sizes of period products throughout each period. Use different products when it's heavier versus when it's lighter towards the end, the last couple of days. Then, as soon as the uterus starts releasing a period, the cycle starts over again, and the brain tells the ovary to start preparing another egg. So let's do a quick normal or nah. So let's say I come to you and I say, my period blood doesn't really look like blood. It's darker than normal blood, and it sometimes even looks like black. Sometimes it's almost like chunky. Is that normal or nah?
No. I think that's normal at all.
You guys think?
What y'all think?
It's not normal. It's not normal. No.
So you're saying no?
No. I see one thumbs up. I do. So actually, that is normal. When blood mixes with the other things from the endometrium, the tissues and the fluids and the nutrients and the blood, it can come out looking, lighter than you would think blood looks like. And as the blood sits in the uterus waiting to trickle out, you know, the last couple of days of your period, it actually can turn darker. So like older blood turns darker colors. One way you can think about this is thinking about like if you've ever had a scab, how as your scab heals and as the blood gets older, as the more days go on, the blood starts to look darker in a scab. So in the same way, as the blood sits in your uterus for a couple days while you're having your period, it can get darker, and that's just normal. If you're having chunky blood, that just means like clotted blood. So that also happens when blood sits in the same place for a while, like in the vagina or in the uterus. And chunks or clots are most common in the mornings, like right when you get up. But if you're passing like larger, bigger chunks and it's happening all throughout the day and not just in the morning, you should talk with your doctor because that could signal just that your periods are too heavy. But overall, having different colors of blood, different consistencies of blood is actually normal. Okay, so let's review the entire menstrual cycle. Buckle in. So technically speaking, the menstrual cycle starts on the first day that your period starts. So while you're menstruating, while you are releasing that, you know, period fluid, at the same time, your ovary is getting those signals to start preparing a new egg in the ovary. So basically they are growing and getting a new egg ready. And the scientific word for that is called the follicular phase, but we're just going to call it the egg prep phase. So after you have your period, the next phase is the egg prep phase when your ovary is like growing one and getting one ready. The first egg to get big enough is released into the fallopian tube, and that is called ovulation. So the egg getting released from the ovary is called ovulation, and it travels through the fallopian tube towards the uterus. And if it's not fertilized by sperm, it continues towards the endometrium. And then, so after ovulation, we move into this next phase, which the scientific name is the luteal phase, but we'll just call it the premenstrual phase, meaning the time before the period. So premenstrual, before the period. The premenstrual phase is almost exactly 2 weeks. So see here, it says 14 to 15 days. So that means like if you had a little crystal ball and you could predict the future, predict your next period, you would know that you ovulated, 14 days before that date. And it's why predicting ovulation is so tricky, because you basically have to predict the future, which is pretty tricky. Pretty tricky. So if there's no pregnancy, then the endometrium, because remember that, builds up and gets ready to grow a baby. That's not needed if there's no fertilization. So instead, it's shed as a period and the cycle starts over again. I know that was a lot, but I think you guys got it. So we start with the period where you're shedding your endometrium. Then your ovary is preparing a new egg called egg prep. Once it's ready, it's ovulated, and then you go into your premenstrual phase. Okay, now your turn. So let's name the phases, starting with number 1, which is called your period. All right, it's already up there. That should usually last between 3 and 7 days. And in between periods should be about between 21 days and 45 days. So after you have your period, the first phase is when what is happening? This thing is doing its thing here. Yep, do you remember what that's called when the ovary is preparing? The egg prep. I think I heard it. Yep, the egg prep. So after the egg prep phase and the ovary grows an egg that's big enough, it pops it out into the fallopian tube. And what is that called?
Ovulation?
Yes, that's called ovulation. So then if there's no fertilization, what phase is next? it comes before the period, so it's called the premenstrual phase. And then it's time, oh, does that work? Okay, and then it's time for your period again, so the cycle starts over. Great job. I know that's a lot. Okay, let's go to the next slide. Oh, why is it not working? Okay, so one thing that can help you understand your period is to pay attention to how long your cycle is, and that's measured by counting from the first day of one period to the first day of the next. Your average cycle length is between 28 to 35 days. That can be, a little less regular for young people, but as you keep having a period, it gets a little bit more regular. And again, you count it from the first day of one period to the first day of the next. So when you keep track of your periods like this, it's called period tracking. Love that. And there are lots of ways to track this. You can write it down. You can use a calendar or a journal or a planner, or you can even get like apps on your phone. And the one that I used to use was really cool because you could put in the days that you had your period, but then you could also put in, track things like your symptoms. So if you were having like changes in your mood or, cramps or headaches or pain, you could also track that. And just knowing that helps you to understand your body better. So let's look at this example. This person's periods are lasting between 5 and 7 days, and her cycles are between 25 days and 33 days. Do you think that those ranges are normal?
No.
So I'm going to tell you that the answer is yes, they are normal. Normal periods can last anywhere. Oh, here we go. Yep. Normal periods can last anywhere from 3 to 7 days, and they're not always the same from month to month. When it comes to cycle length, it's normal for them to be between 21 and 45 days, which is basically like 3 to 6 weeks. Once you've had your period for more than a few years, the cycle length usually gets a little bit shorter and a little bit more regular. Yeah. So let's do another normal or not. So I come to you and I say, I've noticed lately that my periods are lasting a full 2 weeks, and I feel like it's ruining my life. Is that normal or not? What do you guys think? Having a period for 2 weeks.
7 days to 2 weeks, not even. 14 days to 2 weeks.
Yeah, so do you guys think that's normal or not? I'm hearing some good discussion.
Normal.
Wait, I heard a nah, so that is correct. Periods last between 3 days to 7 days. So if your periods are lasting more than 1 week, you should definitely let a doctor know, because that is not normal. Okay, another one. I thought I was supposed to get my period every month, but sometimes it happens every few weeks, and sometimes it takes like 5 weeks before I get one. Do you think something's wrong? Is that normal or not? Having a period every 3 to 5 weeks. What do you guys think?
4 weeks in a month, no, 5 weeks in a month.
Yeah, I think it's normal.
Yep, I see a thumbs up there in the back. That is correct. That's normal, especially in the first few years of having periods. Your normal cycle length can be anywhere between 21 to 45 days, which is about 3 to 6 weeks.
Yep. So awesome. Now that you all know your body parts and how they work together during your menstrual cycle, does it still feel awkward to talk about it?
No.
Yay! And I know.
Love it.
Thank you for that person who said no. I know some people might still feel a little bit awkward, and that is perfectly normal. Like, I felt a little bit awkward talking about my period, but the more you talk about it, the easier it gets, okay? And as future doctors, we want to share another message with you about just some truths about your body. And since this is a pep rally, we want to give you a pep talk, okay?
Love it.
So
go back. You just tell us something, yeah.
Okay, yeah. So this is like a pep talk about kind of how we've grown, just talking about our periods and some things we've just talked, like learned. So I remember when I first started having my periods in middle school, they were really, really heavy. And I used to play volleyball, so I would wear like the spandex, and then I wanted to use a tampon, but I just didn't really understand like the different flows and how to choose the right tampon. So sometimes I would bleed now and then on like some articles of clothing, or like on, I remember bleeding on like my friend's father's car when he gave me a ride to like practice. And it's just one of those things I just like remember feeling really awkward about, but I shouldn't have, because everyone, if you have a vagina, you're bleeding, and it's normal. Like blood comes out every 3 to 5 weeks.
Every 3 to 5 weeks.
And that is perfectly normal. And it's just something I can freely talk about now.
Yeah, just your normal body doing normal body things.
Normal body things.
Normal body things. Mine is similar. I grew up actually dancing. And so we would have to wear, you know, tights and leotards and things. And so it was really awkward for me to find the right period products. And then it was also really awkward for me to like dance for a couple hours and get, you know, sweaty and feel like my vagina like smelled bad and wrong. And I was like always so embarrassed about like that everybody around me could like smell my vagina, which sounds crazy now, but you know, at the moment it was like, it made me feel really awkward and really nervous, which is why I think it's so happy that we're here to just tell you guys that like, that's so normal. And we used to feel the same way. So it's normal to feel that way, but it's also, you know, again, just normal body doing normal body things.
Doing amazing things.
Doing amazing things.
What do you want to share?
Wait, I think that's a good little transition.
Okay, perfect.
Yeah.
Okay, so just to summarize some of the truths you should know, okay? We want you to know that your body is powerful, your vulva looks fine, discharge is normal, your vagina cleans itself, and periods are not dirty, okay? I want you guys to repeat 2 things with me, okay? One of them is periods, and well, I see that you're eating, so repeat it in your mind, okay? Periods and not dirty, and the vagina is not dirty. Like this is, again, one of the slides, take home. Your body is amazing. Your body is powerful. It creates lives and sends it into the world. And it's literally so phenomenal.
Yeah. Your body works really hard for you. So you should be proud of it.
Yes.
It's amazing.
Okay. Okay. And yeah.
You want to what?
Y'all paying attention?
Okay. Perfect. Okay, so now that you know that your period is normal and it's nothing to be embarrassed about, let's talk about some options for managing your flow. And just keeping it off your friend's father's car. Like I
hate that.
Yeah. So whenever you go to the store and you go down the aisle, it can feel overwhelming. There's several options out there and more options are coming out. There's the pads, the tampons, cups, and underwear.
So many things.
So many. We're going to focus on 2 of them today, okay? We're going to focus on the pad and then we'll talk about the tampons later. So a pad is also called a sanitary napkin. So you probably know, so how do you use a pad? So when you get a pad, there's an adhesive tape on the back side. You pull off the adhesive tape and you put the sticky side on your underwear so that the pad is below your vagina to catch the menstrual flow. We are laughing because I told Katie that when I the first time I ever used anything, my first period, I put the sticky side on my vulva.
On your vulva.
And it was very painful to take off, as I also had some hair down there. But don't be like me. Stick it on your underwear, okay? There are lots of different sizes. They're like panty liners to mini pads to maxi pluses, and there are just so many different ones. So because there are different flows and there are different people who just need like different sizes. And then pads also have wings, like the one that you see on the picture. And the wings are really cool because it helps keep the pad from like bunching up or sliding around. And most people will need to change their pad at least every 4 to 6 hours. And then sometimes people change their pads more often because like the pad might just accumulate some like more sweat, or just more like discharge, and people might feel more comfortable changing it more often. And hopefully, this is another thing, you know how to dispose of the pads. Do not flush it down the toilet.
Which I did when I first started having a period, because we didn't talk about it. My mom just gave me the period products and said, figure it out, and never told me how to use them or how to dispose of them. And so when I used my first pad, I rolled it up. And so all the sticky sides were on the outside, and I tried to flush it down the toilet. And as you can imagine, it got stuck in the toilet and it clogged the toilet.
Yeah.
So I haven't done that again. So my recommendation is to just fold it up, wrap it up in some toilet paper, throw it in the trash can, or if you're in like a public place, there's usually a trash can in the actual stall. So you can just throw it away right there.
Yeah. We are like literally walking textbooks of like what not to do. But we're here so that you don't have to make the same mistakes that we did.
Yes.
Okay, then let's talk about tampons. So this is a tampon with an applicator. So the applicator is the plastic or cardboard part that helps put the tampon easier inside, okay? And then there are some tampons that don't have applicators, so you just have to like insert the tampon in with your finger, which is fine. You just go out and you wash your hand afterwards, okay? The tampon is inside this dense tube, and it's made of cotton, and it fits inside the vagina to absorb the menstrual flow as it comes out of the cervix. It sounds painful, but in reality, it's not. If you put it in correctly and you use the right size, you wouldn't feel it, okay? We're gonna show you a video on how to insert a tampon in a minute, but I want you to know that if you're old enough to have a period, your vagina is big enough for a tampon. But at the end of the day, it's your choice. As you can see, there's several options on here on how to like catch your period flow, and whatever you decide, it's your choice. But just some things, if you're going to use a tampon, there are 3 things you should know to avoid an infection. The first one is you always want to start with the lowest absorbency. So they're like, what's it, like regular, super?
I think they even have like small.
Like light, yeah.
Light.
Yeah. So it's light, regular, super, super plus. So start with the lowest absorbency that you think you need, and then work your way up from there. So if you think you need like a super, maybe start with like a regular, and then change it more frequently. And then never wear a tampon more than 6 to 8 hours. And then only use tampons when you're actually on your period, okay? So let's go watch the video now on how to insert a tampon. Let me pull it up.
And it works.
Yeah, okay, I'm gonna play the video.
Let's talk about putting things in it, and that's only if you want to. I know it sounds scary, but trust me, you'll be fine. So the first thing we want to make sure we do is wash our hands, because we don't want to introduce any bacteria into our vulva and our vagina, right? So our hands are clean now. What's next? I have a handy dandy vulva here. This is my little vulva puppet, and that's what I'm going to use to demonstrate how to insert a tampon. All right. So for demonstration purposes, it's going to be looking at you. Sorry. But honestly, when you're sitting down or however you feel comfortable positioning yourself, it's going to probably be more angled like this. And the next thing that I want to have is our tampon. So there's a nice little grippy area right here where you kind of pinch the tampon, get a nice firm grip. And trust me, it's not going to go anywhere. You're not going to hurt yourself. All right. So with our vulva here and our tampon, we're going to bring the tampon to the entrance of the vulva and the vagina. We're going to slowly insert it until we're at the grip part, so tip to grip, and you're angling it towards your lower back. Trust me, it doesn't hurt. You can't get it wrong. Once we feel like our fingers have met the vulva's entrance, we're gonna press the plunger, and a tampon goes in, and what comes out is your applicator. Now, that'll be discarded later, and all that's left, honestly, is that tampon and the little string, and you can barely feel it. And then you're done.
But if it's your first time, it's gonna hurt.
It shouldn't hurt if you have, is this one, right? It shouldn't hurt if you have the right size. Okay. So get the right size, and if you follow the instructions, it shouldn't hurt.
It does take a bit of a learning curve,
Mhm.
though. Yeah.
So just so you know, there are other options, like there's a disc, there's period underwear, and if you check out like period
Education project.
yeah, period education project, they have videos and papers about it. Okay, so we have time for another normal or not. So your friend tells you that their mom told them to buy these huge pads and they're bleeding through 8 of them a day. Do you think that's normal or not?
No. Yeah.
8.
Too many pads.
Okay, yes.
Love the discussion.
Nah, that is not really normal. So according to some research, it's normal to use 3 to 6 period products. So if you're using a pad or a tampon, you should be using 3 to 6 per day. And obviously it would depend on the size product you use and how full you let it get before you dispose of it. But it shouldn't be saturated with period blood and for you to be using more than 8 a day. So that is not normal. And if that is happening, always check in with your doctor, okay?
Yeah.
Okay, so this is like, kind of like my favorite part because I get to show what's in my bag. So once you decide on the products you want to use, you might want to just like pack a personal bag filled with like all the goodies that you think you're gonna need on your period. It can be any kind of bag you want. So, and you can put, so this is like my bag that I put like my period stuff in it, and it goes into like my bigger bag, like my bigger school bag. You can put it in your locker. You can put it anywhere that you think you're gonna want access to it. So what's in my period bag? Okay, so I have like, cause I use tampons, so I have a tampon, and then I used to have liners in there, but I don't have it in there right now, which is another thing. Always make sure you restock your bag after you take stuff out of it. So I sometimes have liner in there, and then yeah, and then I have like Midol, just because sometimes like period pain does hurt, and if it becomes uncomfortable, I would just take like one Midol to help with the pain. And
Oh, I keep in mine as well, in my backpack, an extra pair of underwear, just in case I ever need it.
yeah. So she told me about that trick, and I started doing it now. It really comes in handy sometimes. Okay, and then so just think about when you go home, what you think you might put in your period bag. So now you know a lot about what's normal or not. Let's do a quick review, okay? I'm going to ask you well, it's on there. So I remember it is on there. So let's just say it together. We'll just talk about it together. So what is like a normal age to start? 9 to 16 years is a normal age to start. Your normal cycle length should be 21 to 45 days. You measure your cycle length from day 1 to day 1. You should be using 3 to 6 products a day. And your period shouldn't last more than 7 days. And all colors are fine. As you can see, it can be light pink, it can be a darker red. That's perfectly fine. And normal period pain should get better with simple things like exercise, a hidden pad, or over-the-counter medications, like I said with my Midol. So those things should help with period pains. And if it's not helping, who should you talk to? Yes. Okay. Well, we have 2 more normal anons. Yeah. But yes, one of them. I come to tell you, sometimes during the first couple of days, my periods are so heavy and painful that I can't even go to school. I can barely move and I can't concentrate. Is that normal or not? Okay, I'm seeing some thumbs up. In reality, it's not normal. So your period, like we said earlier, there is pain associated with your period that makes it uncomfortable. But if it's so bad that you're vomiting, you have diarrhea, you're fainting, or it makes you miss out on things that you would consider fun, then you should definitely see your doctor to help you get your period pain under control. It shouldn't be something that is like preventing you from like
living your life
and having fun.
Yeah, because you have a period, about once a month. So if once a month you're, it's disrupting your day, then that's actually not normal.
So definitely talk to someone. Okay, and then this is like the last, normal or not. Okay, yeah. So I think I'm the only one of our friends who hasn't started my period. I just turned 15. And do you guys think something is wrong? Is this normal or not?
It is normal because some people are late bloomers, right?
Exactly. I don't even have to say it. Yeah, some people are late bloomers. Remember, the age is between 9 to 16. Yeah, perfect. But if after age 16, definitely see your doctor. So, great job, guys. Do you feel like you know more?
A little bit.
A little bit.
A little bit, yes, that's perfect.
Love it.
I can tell that you do. But you might still have questions, and that's perfectly fine. So we want you to know about where you can go to get information that's trustworthy. So you can go to the Girlology. I always have troubles with that word. Help me, Katie.
Girlology.
Girlology.
Yeah.
That's a tongue twister. Or you can just like search like the Period Education Project. They have a YouTube channel with like several resources. And also tampax.com has phenomenal resources about periods, puberties, and other questions you might have about just.
I've been seeing Tampax ads.
Yeah, so they have important information. Okay. And then,
Okay. Wait, thank you guys. That's all we have. So we do the resource that Onyee was just talking about, the I think it's
the book.
The book. I think it's in here.
Yeah, like the scan it.
Well,
no, it's this.
Oh, do we send it out?
The free ebook.
Oh, there it is. Okay, so one of the resources that Girlology puts out is this free ebook that has a lot of like frequently asked questions and resources and things. So we have that for you all. And then we also have, if y'all have your phone, just a little survey to ask about how you liked this little program. So I think that if you just pull out your phone and hold it up to the QR code, that should work.
If you don't have a phone, I don't know.
We can send it out. We can send an email as well. Yeah.
I'm gonna send it to y'all. Y'all want to airdrop?
I got it.
Oh yeah, perfect.
I'm
And
airdropping.
then it looks like it's about 6:15, so we have about 15 minutes if you guys have any questions for us, and we can try and answer those as well as we can.
Yeah, and then this is also the scan for the free. Well, Katie already said that for the free ebook too.
Love it.
This was so much fun. You guys,
fun.
Oh, I get so excited. We wish we could be in like person.
I know.
And we're all the way in
Kentucky. But truly, our bodies are amazing things. And I don't know if you guys could tell, but we love talking about it. And we hope that you guys feel the same.
What was not covered in the news?
Any questions, girls? Anything? Really? So y'all just experts with this here thing.
School has taught me
Because of them we are.
Oh, okay. So
JV period pros.
Yes, JV.
Science has taught me too much. Exactly.
Not one of my bottom things, and I can't remember. But
Would you attend another?
what?
Well, if you guys don't have any questions, that's all we have. Thank you. Seriously. Thank you for your attention, for your participation. And I hope that you guys feel just a little more comfortable, talking about your bodies and the normal things that your body does. Anything else to add?
No.
Okay.
We thank you guys for taking the time out to educate us.
Oh my gosh.
We really
Of course.
appreciated it. Guys, y'all say
Thank you.
Thank you guys.
Okay.
And we can send out that ebook as well afterwards.
Perfect. Thank you. And they're filling out the survey. So
Perfect.
Thank you so much.
Yes.
thank you guys. Y'all have a great one.
Guys too.
Bye.
I know my school, they got.
That was so much fun. I wish we could do it in person. Okay.
I know. Okay.
Okay.
Okay. Let me wait. We'll see if Katrina has anything to say. I'm gonna leave
Okay.
over here. I'm sweating.
Same. I'm
Oh my
afraid
gosh.
to like.
Wait, that was fine.
Yeah.
Okay.
Hello. Let's type in the chat.
Okay.
Okay, I can stop screen sharing. This was a
I mean,
face. Oh, it's not showing, but I feel moist.
oh, that was good.
Where's the
Okay.
chat? I swear I use like. I feel so like
Old.
Like I don't
Like
want
a-
to Zoom every day.
We've literally done med school Zoom Zoom med school for like 2 years now.
Oh, should we? Can we go? We want to send in
Evening. Don't say that.
Oh, hi Katrina.
Yeah.
You know I'm like a
Say, do we need to do anything else? Oh, I think we do actually. There's like a post survey that we have to fill out. I'll pull it up.
Here, let me unmute myself. Oh, we're not the
Okay,
one
for
I mean, she's
recording
the one
purposes, I
recording.
know we're just gonna.
Oh.
Bye. Thank you.
We're unmuted,
No, we're not. I just
Oh.
unmuted us.
Okay.
Thank you. Until next time, we'll be in touch and we'll fill out the survey. I think that's it. Okay.
Oh, let me leave meeting.
Yeah.
Well, I think if I leave it, okay, I'll just assign.
Yeah. Assign and leave.
There we go.
wash me, wash me, wash me, wash me.